everyone, my name is Tania Nixon and I'm going to talk about diabetes in women. Diabetes is a condition causing high blood sugars due to inadequate insulin production, or body cells are unresponsive to insulin or don't use insulin properly, or it can be a combination of both. Diabetes is the seventh leading cause of death in the United States. There are four types: pre-diabetes, type 1, 2, and gestational. Pre-diabetes is when the blood glucose levels are elevated but not quite high enough to be considered diabetic. Type 1, usually diagnosed in adolescents and young adults, is also known as juvenile diabetes, and 5% of the population is diagnosed with this form. Type 1 risk factors are inherited from both parents and in most cases triggered by environment. Caucasians tend to have a higher rate of type 1 diabetes. Type 2 is the most common form. The body's glucose levels are higher than normal. This is hyperglycemia. The pancreas produces excess insulin, then over time isn't able to keep up and doesn't produce enough to regulate normal blood glucose levels, which is hypoglycemia. Type 2 has a stronger family history lineage than type 1 and is also triggered by the environment. It can also be influenced by your lifestyle. Gestational diabetes is diagnosed in expecting mothers only and is usually developed around the 24th week of pregnancy and dissipates after birth. Having gestational diabetes does not mean there was an actual diagnosis of pre or post diabetes. Common symptoms include urinating often, feeling very thirsty, feeling very hungry even though you have recently eaten, extreme fatigue, blurred vision, cuts and bruises that are slow to heal, weight loss even though you are eating more, tingling, pain, or numbness in your hands and feet. Diabetes is diagnosed through hemoglobin A1C, fasting plasma glucose, oral glucose tolerance test, or random glucose plasma test. The rate of prevalence of diabetes in the general population in 2012 was 9.3% of Americans. That's 29.1 million Americans. Diabetes in 2010 was stated to be the seventh leading cause of death in the United States. Over 69,000 death certificates were signed as being the primary cause of death. Over 234,000 certificates listed diabetes as an underlying or contributing cause of death. Rates of prevalence in women include 8.8% of women over the age of 20 that have diabetes. The prevalence increases with age, and 21% of adults older than 60 have a diagnosis of diabetes. Latins, American Indian, African Americans, Asian Americans, and Pacific Islander women are at higher risk than white American women for diabetes. I completed a literature review of 8 articles. The first, Clinical Features of Binge Eating Disorder in Type 1 Diabetes, a case study, debates association of binge eating and hypoglycemia. What they found is that insulin-dependent diabetics may signify risk factors for eating disorders. It's important to note their claims have not been substantiated by further studies. The second, women with insulin-dependent diabetes mellitus complicated by eating disorders are at risk of exacerbated alterations in lipid metabolism. Here, the authors evaluate lipid parameters affecting women with diabetes exhibiting eating disorder behaviors. The results were that women with eating disorders were controlled eaters, and women with diabetes and eating disorders who displayed bulimic behaviors consumed considerably more energy, total fat, and cholesterol compared to the control group. The third article, Evaluation of Ovarian Reserve of Endometrium in Women with Type 1 and 2 Diabetes Mellitus. The authors evaluate ovarian reserve of premenopausal women with diabetes. Results were high menstrual irregularity, increased rates of premature menopause in women with type 1 diabetes, and they found that type 1 diabetic women are at greater risk of menstrual disturbances such as amenorrhea. In the fourth article, Management of Pregnant and Postnatal Women with Pre-Existing Diabetes or Cardiac Disease Using Multidisciplinary Team Modules of Care, a System Review, they attempt to determine the most appropriate multidisciplinary team models of care to manage multifaceted medical illnesses during and after pregnancy. What they discovered is that there was a shortage of evidence to enlighten structure or working practice or beneficial influence on maternal and infant outcomes or health care resources. In the fifth article, a randomized translational trial of lifestyle intervention using a three-tier shared care approach on pregnancy outcomes in Chinese women with gestational diabetes mellitus but without diabetes, the study tested the efficiency of lifestyle alterations executed in a three-tier shared care on pregnancy outcomes of gestational diabetes mellitus. The conclusion was the lifestyle modification using shared care systems improved pregnancy outcomes of women with gestational diabetes. The sixth article, Weight Variation and Incident Disease in Older Women, the Iowa Women's Health Study. The study evaluated the connection between weight inconsistency and disease incidence in women. They found that adjusted relative risk of MI, stroke, diabetes, and hip fractures were amplified with increased weight inconsistency. The soundest connotations between weight change categories and disease was that of diabetes. In the seventh article, Association of Poorly Controlled Diabetes with Low Serum Leptin in Morbid Obesity, the authors evaluate the probable relationship between serum leptin concentrations and hyperglycemia in patients who were morbidly obese. The results showed poorly controlled diabetes was complemented by meaningful reductions of serum leptin concentrations in morbidly obese subjects. What this means is that leptin deficiency accompanying insulin deficiency in patients might contribute to the maintenance of obesity or metabolic impediment. The last article, Gender Discrimination for Women with Diabetes mellitus in Algeria. The study sets out to discover if women are more concerned with diabetes, since obesity is more frequent in women, and if there is a sort of sex discrimination for diabetes complications. Findings suggest that gender discrimination between men and women exists mostly for older age females. Women are more susceptible to complications and death related to diabetes than men. Women have more occurrences of coronary disease and cerebral vascular accidents, especially those suffering from diabetes. These complications are contributed to the decline in physical activity, eating disorders, hormonal changes, and high sensitivity to stress secondary to frequent obligations that women take on in this modern society. As we've learned, there are several causes for diabetes, anywhere from elevated hemoglobin A1C, eating disorders, premenopausal, menstrual irregularities, gender, genetics, weight inconsistencies or obesity, or lifestyle modifications, and several of these, as you can see, are intertwined. In a social work perspective, given the character of diabetes, its increased occurrence, and patient-dependent therapy regime, social workers have an enormous potential to advance the lives of individuals facing this chronic illness through roles as educators, advocates, counselors, therapists, community developers, and resource brokers. Another article stated, enhanced mental health evaluations and mental health services delivered by social workers in diabetic education programs and or principal care locations would increase a client's mental quality of life. Social constrictions are found to be associated with decreased devotion to general diet and exercise, which is simple self-care. These relationships were mediated by lower self-efficiency to perform diabetic care activities and heightened negative mood. Social constrictions are also coupled with increased thought intrusions associated with diabetes through the instrument of anxiety. The results are consistent with Leeper's social cognitive model, affirming that social constrictions are obstacles to cognitive and emotional processing of demanding and stressful incidents. The Diabetes Association of Atlanta originated in 1952 by Ms. Ernest Louise Williams. This organization is staffed completely with parent volunteers of children who had diabetes. Through the years, the Diabetes Association of Atlanta materialized into a full-service agency dedicated to improving medical, financial, and psychological impacts that diabetes has on clients and their relatives. The Diabetes Association of Atlanta is a nonprofit organization addressing the necessities of all individuals affected with diabetes through components of screening, self-management, education courses, healthy habits, youth programs, and medical assistance. The organization services the counties listed below. Cost of medical care with diabetes estimated at $11,744 versus $5,095 without diabetes. 354,000 adults residing in Georgia are estimated to possess undiagnosed diabetes, and 19,459 emergency room visits were contributed to diabetes in 2006. A health-related policy that would apply is that of the Patient Protection and Affordable Care Act of 2010. Targeted populations include those without affordable quality health care. The goal is to prevent denial of coverage and lifetime limits, provision of preventive care, stronger consumer rights protection, and improved access of coverage for a greater population. The New York Times reported in 2014 that an analysis completed by a group of reporters and data researchers determined the program was largely successful in its delivery. As a matter of fact, the number of uninsured have fallen, insurance has been affordable, and healthcare industry has been assisted with provision of new customers. In conclusion, diabetes is the seventh leading cause of death. There are 4 types: prediabetes, type 1, 2, and gestational. Symptoms include frequent urination, thirst, hunger, fatigue, blurry vision, slow healing, weight loss, tingling, pain, or numbness in hands or feet, and it's diagnosed through hemoglobin A1C, fasting plasma glucose, oral tolerance test, or random plasma glucose test. Social workers can assist through delivery as educators, advocates, counselors, therapists, community developers, and resource brokers.